It was New Year's Eve 2019 when word began to trickle out of a cluster of viral pneumonias of unknown origin in Wuhan, a city of 11 million people in central China. It would soon be determined that the cause was a novel, meaning previously unknown, coronavirus. What was initially thought to be a flu-like disease that had made an unusual jump from animals to humans, likely in Wuhan's live animal market, quickly spread in the community. The virus had mutated to allow for person-to-person transmission. The pandemic had begun. In January 2020, China logged its first death from the coronavirus. The city of Wuhan is shut down. The U.S. restricts travel from China, and the World Health Organization declares a global health emergency. February of 2020 saw the first death outside of China, in the Philippines, followed by France, Italy, Iran, Latin America, and finally the U.S. The disease gets a name: COVID-19. By April, COVID is spreading with breathtaking speed. 1 million cases already worldwide and more than 200,000 deaths. Dr. Richard Besser, former Deputy Director of the CDC and now President and CEO of the Robert Wood Johnson Foundation, explains how this virus could spread so quickly.
It has to be easily transmittable between people. COVID does that. It has to cause significant disease, and COVID does that. And it has to be something for which the population doesn't have underlying protection or immunity. We see that with COVID.
By summer, we learned older children were potential COVID spreaders. Airborne particles confirmed as the primary route of transmission. Moderna and then Pfizer began large-scale human trials on its vaccines. Risk factors like obesity and diabetes are shown to elevate mortality rate. The fall brings worse news. U.S. cases soar past 10 million. Global deaths top 1 million. But several drug makers report positive results from their vaccine trials. That glimmer of hope dimmed, though, when a coronavirus mutation was detected spreading in Britain. Other variants were soon found in South Africa and Brazil. Experts expected mutations, but
some of them, unfortunately, seem to make the virus spread more easily, and some make it more deadly. And when that happens, if the variants are too different from the original strain, you may actually see people who got the infection early on become susceptible to that new strain, that new variant.
The good news is that present vaccines seem to offer good to at least partial protection from these variants, and Pfizer and Moderna are already testing new vaccine formulations against them. While this past year has been long and trying, we have learned an extraordinary amount about this virus, and we will continue to learn much more in the days to come. Improved treatments and better drugs, more vaccines, how and why it causes long-lasting symptoms, so that we will not have to face another year with 2.5 million dead worldwide. Dr. Max Gomez, CBS 2 News.